So, good morning and good afternoon, ladies and gentlemen. Thank you so much for joining us. Maybe we could give everybody 1 or 2 minutes, and then we can start. Great. So, just giving everybody 1 more minute, and then we're excited to begin. Okay, so we're 2 minutes in, and I believe we have a good number to start. So, let's get right into our webinar. So, once again, good morning, good afternoon, depending on where you're joining us from. We're really excited to host this webinar today. Thank you for joining us. My name is Agnes Ngure, Technical Lead on Design and Demand at Japigo. I will be your moderator for this exciting session as the world celebrates Human Rights Day. Now, today, December 10th, is Human Rights Day, which is a reminder that the right to health is not just a principle, it's universal entitlement, and that every person everywhere deserves access to safe, respectful, high quality healthcare without discrimination or barriers. And so today we are joined by an exceptional panel from Japigo, and they represent three areas where human rights has a profound impact on health outcomes. So allow me to introduce our speakers for the day. Now, our first speaker is Megan Christofield, and Megan is Japigo's principal advisor for family planning. She has a master's degree in women's and reproductive health and a bachelor's degree in peace studies. So really today's conversation sits at the intersection of her training. Megan, maybe you can just wave to everybody. Next, we have Carol Ajema, based in Kenya. Carol is a senior technical advisor and Japigo's gender focal point. She has a bachelor's degree in sociology, a master's in social work, and a doctorate in public health. And today, she will highlight the importance of addressing social determinants of health. So, welcome, Carol. And then we finally have Michael Mwiti Mudhamia. And Michael is a senior regional program advisor at Japigo with over 14 years of experience in reproductive and maternal health. He has been recognized for his expertise in designing, implementing, and monitoring reproductive and maternal health interventions, driving impactful health outcomes. So, Mike, just say a quick hello to everybody, or just wave. Now, their perspectives will help us explore how a human rights lens shapes real practice, from addressing gender dynamics to ensuring reproductive choice and delivering respectful maternal care. And so let's begin our conversation with a broader reflection on Japigo's approach. And as we get into the conversation, I encourage the participants to mute their microphones if possible, so we can have a collaborative session. And then, secondly, I would also encourage the participants to participate as much as possible. So let us know in the comments what health as a human right means in the context of your work. So send us any comments, any questions, and then we'll be able to read them or respond to the questions at the end of the session. So, Megan, Jopaigo works across many countries, health systems, and technical areas. So, from primary healthcare to digital health and workforce strengthening. Now, from your perspective, how does Jopaigo integrate a human rights lens across its programs? And why is this approach essential to the way we work as an organization? So, tell us, Megan.
Thanks so much, Agnes. And thanks everyone for joining us today on Human Rights Day. And maybe even before I respond about how I see Japaigo contributing to the rights agenda, I wanted to just step back a little bit and return to really two ways we can think about rights and the right to health. One is when you think a little bit more literally about how you can use like the WHO's framing or anyone else's, that the right to health is really that every person is entitled to the highest attainable standard of health without discrimination, with dignity, and it includes things like availability, accessibility, acceptability, and quality, right? And that's sort of the what of rights. Um, but I also think it's really important that when we talk about rights and for our conversation today, to remind ourselves of the work of folks like Paul Farmer and many other social justice scholars who remind us that health systems do not fail people randomly. This is not a random occurrence that rights are not attained. Inequities reflect underlying structures, policies, and power systems that can hinder people's ability to meet their rights, particularly the right to health. And so those two angles, I think I would invite us to hold as we have this conversation, that it is what rights are, but also what keeps their attainment at bay, because that's really crucial to how we move towards attaining those rights. So from that perspective, then, if I were to sit back and think a little bit about how Japaigo, our relationship with the right to health, I really see Japaigo integrating human rights lens in ways that are grounded and evolving. They're not perfect, no one is, but they come across in a few key ways. I think, number one, we pay very close attention to who is being reached and who isn't with health programming, and what barriers stand in the way of those not being reached, whether those barriers are related to gender, geography, age, or stigma. And that focus on equity and choice really shapes how we design solutions and our work, really. We also make a really deliberate effort to bring clients, communities, frontline providers, and others into the actual design of our interventions. Of course, Agnes, you know this better than anyone as a designer, but that co-creative process is not always as easy or as extensive as we'd like. But when we do this, when we invite folks to participate in the work itself, whether that's with young people, helping design the HIV programs that are to help reach their HIV goals, HIV prevention goals, or with providers when we're introducing new contraceptive options, that co-creative process really strengthens dignity, trust, and relevance, which are important from a rights perspective. And of course, it also includes or also improves our health outcomes. I think rights also shows up in our systems level work. Our work to strengthen primary healthcare, integrate digital tools into various technical interventions, and strengthening the health workforce are all efforts that support the conditions that make rights real and pragmatic and practical. Those interventions deliver on things like reliable services, respectful care, and continuity, which are really important to that availability, accessibility, affordability, and quality that we talked about earlier. And then finally, and I know Carol will touch on this more, but we acknowledge that there are deeper structural issues that do inhibit people's ability to have their rights met or to meet their rights, like gender inequality, discrimination. These are really like wicked issues, right? And some of the work we do is to surface those powerful forces and design either to work around them or to push through them. And so one example of this work is like our work in expanding access to self-care, which happens across many different technical domains: contraceptive self-care, HPV self-sampling, HIV prevention, et cetera. But all of those self-care solutions are really meant to give people more autonomy over how they manage their health. And that really is in recognition of the constraints that they face in accessing facility-based care. We also have work that really pushes through some of that discrimination. I think a lot about our work in HIV prevention, which in a lot of cases is there to unpack and address very deeply held stigma, behavioral patterns that we see in healthcare providers and health system actors, and really revisit and reprogram care so that we can, really move through and fix some of those behavioral biases. So for me, integrating that human rights perspective here at Jhpiego is less about claiming that we've arrived in some fixed place, but it's more about how we're continuing to ask the questions about equity, about agency, about accountability, so that our work is really moving us closer towards a world where everyone can achieve their right to health.
Oh, wow, Megan. I wish you could just go on and on. Dignity, trust, relevance. Thank you so much, Megan. Well said. Now, over to you, Carol. When we talk about health as a human right, why does gender matter so much, especially in today's world? And what's one practical way you've seen gender considerations change how care is delivered?
Sure, thanks. I'll just pick up from where Megan really stopped at, because for us as Jhpiego and stakeholders in this field, it's not just about talking about rights for the sake of it, but we are also building on the understanding that there are many factors that really influence people's decision-making power. We also understand that the communities we serve are not homogeneous in nature. So there are many underlying things that would determine who accesses care, where they choose to access these services, and from who really they find it more convenient for them to access these services. And over the years, we have seen across all the nations that there are still disparities in how people are taking the services that are available. Yes, the legal framework speaks to health as one of the basic rights that every individual is entitled to. But can we say that at this point in time, people are able to access that right without questioning? No. And that's why we are having this conversation today. For people to be able to look at just beyond having the right to vote in a particular political leader, you as an individual have a right of choice when it comes to the type of care that you need when you're sick or when your beloved one is really feeling unwell. And we also recognize that we cannot just be championing for health as a right without understanding what are some of the dynamics that influence people's choice. Here we are looking at decision-making power in relationships. We are also looking at who within at the household level has access and control to the resources that really determine where we seek these services from. And for us to be able to access the health services, we recognize that there are various factors that determine who is at risk of certain diseases. Who determines when to be able to, use the household resources to go for services? So literally being able to take a back seat and look at the services are there. But for an individual to be able to come and access these services, we need to look at what geography are they living in? What are some of the biological things that would put them more at risk of a particular disease compared to other population groups? How marginalized are they as individuals? And how then do we as stakeholders pull our efforts together to ensure that we are able to tailor-make services where whoever comes in for services, as Megan rightfully said, is able to access dignified care? And for us to access dignified care, it means we need to be able to understand that there are many other factors that influence our decision making. So we are looking at our income levels, we are looking at the education, we are looking at the religious factors, because we know in certain communities, yes, in as much as we might have these services there, but we understand there are certain norms that really do not promote for people to access those services. So how then do we also engage with the religious leaders for them not to use religion as a barrier to people accessing services? And for us as Jhpiego, one of the things that we are looking out for is working within the broader care ecosystem. So that means we cannot ignore the critical role that providers play in enhancing access to care. So we have scenarios whereby some of the providers will have people come to the facilities, but because of their own value system, because of their own understanding of who really, quote unquote, is entitled to access that service, they end up missing out on key populations. So we still have in this day and age groups that are left out of services. Yes, there are governments that have made efforts to ensure that services are available at no cost. But does that mean that there are no inequalities? The answer is no. So cost in itself is not a barrier. We are having scenarios where, yes, the services are available, providers are well trained, but we need to continually engage with the communities. So to answer your question, Aggie, around what then do we need to do to ensure that these rights are championed and enhanced? What we have seen really work out for us as an organization, and I believe different stakeholders can speak to it, is engaging communities. So when we talk about engaging communities, is understanding that they know their problems, they need to be part of the solutions. And for us to be able to sustain the gains made, we need to be able to build a workforce or a group of people within the community that are able to champion for some of the solutions. And I believe Michael will be speaking to some of these solutions that we have tailored as Japaigo that are really relevant to the communities that we serve. We respect the voices of these communities, and we also really deliberately build their understanding of what services are available and how they can rightfully walk into a facility and be able to ask for these services. And secondly, we're also looking at an integrated approach to delivering services. We are cognizant that there are times when someone will walk into a facility in need of a particular service, but when we don't have an integrated approach to delivery, we might have them missing out on critical services that they would have attained just by making that one visit to a facility. So the key thing here, when we're talking about gender as a key determinant, we are looking at making services available, accessible, and care is provided in a way that the voice of the client or the patient is really at the center of everything that we do. And allow me, Agnes, just to speak to one of the services or projects that we've implemented as Japaigo, where we've noticed that in as much as we have immunization products out there and services, over the years, the care burden has been placed on women. So that particular project, we implemented it in Togo and Pakistan. And what we did was deliberately build the capacity of men to understand that they have a critical role in the care of their children. So empowering them to discuss with their female partners on how they can allocate household resources, how they can determine where their children can access immunization services. And just by engaging them, we have literally seen improvements in uptake of immunization services. I believe we'll be able to converse more even as we continue with this discussion today, Aggie.
Wonderful. Thank you so much, Carol. I'm sure we can all feel the passion that is being projected from Carol's voice. Thank you so much. Speaking about human-centered design and speaking about male involvement. Thank you so much, Carol. Now, Megan, you mentioned equity and choice. Access to care also means having choices, right? Especially when it comes to family planning. And so, why are reproductive health and family planning central to human rights? And can you share a story where giving people these choices transformed their lives or the lives of the communities where these people live?
Yeah. Thanks for that, Agnes. I think the right to decide if, when, and how to have children is probably one of the most fundamental rights that there is, and so it's very germane to this conversation about the right to health and the right to just well-being writ large. And actually, if we were to take that even further and to borrow some of the concepts from like reproductive justice, it wouldn't only even be about the right if, when, and how to have children, but also the right to parent them and raise families in supportive ways, free from violence, with all of the resources necessary to have a thriving family and to promote the next generation. And so I think, it's so fundamental, right? And at the same time, we know that many people, women, adolescents, sexual and gender minorities, racialized people, they are often the folks who have their rights really constrained or limited by oppressive forces. And so, of course, this is why family planning from a rights perspective is so important. And when I think about like a project example or just like a work example of where I think we've done some work on rights that really has transformed the space and had a really meaningful impact. We have like at this point in time, we have 15 projects in 12 countries. But the thing that comes to mind for me is some work that we've done in recent history. Mike was super involved in this work, actually, where we really focused in for multiple years in multiple countries on the right not to contracept and how we make sure that family planning choices are full, free, and informed, both from the onset of, really quality counseling that honors a client's decision around whether or not they want to use contraception to reach their reproductive intentions, but also that we make discontinuation and LARC or long-acting reversible contraceptives removable very easily and readily. And so we did some work in 6 countries to understand and address what are the challenges to method discontinuation and removal, and then worked with national and subnational government actors to really figure out like how do we make removal and discontinuation easier to get to, free from bias? What does it look like to update our data systems, to do specialized training on difficult removal, to incorporate concepts of discontinuation into family planning standards, to introduce and incorporate mandates around removal supplies within supply systems and SOPs, and even developed a number of resources nationally, but also globally, with the help of a multi-partner removal task force. I'll just say I'm happy to share a link to those materials for anyone who's interested. You can just ping me right here on LinkedIn, since I know we're already there and you can see my name. But I think that work really has been really transformational in thinking about, the right to contracept is also the right to stop contracepting for any reason at any time.
Oh, thank you so much, Megan. And yes, kindly share those resources. I'm sure most of us would be interested to learn more about that program. Now that we speak about male involvement, I would like to bring in Mike. So, Mike, as we know, rights don't stop at choice, and they extend to how care is given during life's most critical moments. So, Mike, please tell us, what does it look like when maternal and newborn care truly respects women's rights?
Yeah, so thank you very much for the opportunity to share. And I look at this in terms of the 3 delays model, where if we are to talk about health as a fundamental human right, then we need to think about the barriers and the challenges that we face. I know it's enshrined into different international and national frameworks, but that is not enough. We still have the 3 delays. So the first is delay in seeking care because of lack of awareness, cultural beliefs, meaning that we need to really create a lot of awareness and educate our communities. The second delay is reaching the health facility. For example, if health is a human right, for sure, we should have effective transport system, referral systems that can make sure that a client can get care when they need it. Again, the barriers around cost. If health for sure is a human right, then it should be affordable or free. When the other component is around the delay in receiving care. Sometimes our healthcare providers are overwhelmed in terms of staff shortages, expecting our healthcare providers to do so much, yet they're very few. And if for sure we want to make health a human right, then we need to have adequate and well-motivated staff. Sometimes we lack products and equipment. We also lack adequate training for these healthcare providers to be able to offer the quality care that is key to, quality health services. So I look at some of the things that we've done as JPIGO to make sure that indeed health becomes a human right. It's a journey. It's not a day or 1 year or one project intervention. And some of the things that we've done are categorized around the 6 health system building blocks, talking about service delivery, introducing high impact interventions like postpartum family planning, emotive, and introducing new products. These are things that have been found to be such a big solution in terms of healthcare, and having these solutions at every maternity or every newborn unit makes health a human right. And we've made a lot of progress on that area. Talking about health workforce, we've really invested as an organization in building the provider skills and knowledge to be able to provide high quality care across multiple countries, which contributes to making health a human right. Again, without quality data systems that can be used for data for decision making, we cannot talk about health as a human right. We've invested in digital solutions, monitoring frameworks that guide decision making in terms of investment, so that resources are taken to where health can get the best outcomes when we invest in the right things. The other component that is critical is access to essential medicines and medical devices. For example, we have a very wonderful product. It's the bocabetocin that has been available globally for many years, over 20 years. But when you look at low resource settings, the product is not widely available. Is health really a human right in that line? So we need to make sure that these life-saving products are available in every maternity. And as JPIGO, we've really made a lot of effort to make sure that these products are available in every maternity and in every newborn unit. again, thinking about financing, if we want to make health as a human right, then we need to make it affordable and accessible. Most of the financing is out of pocket. We know most of the families are strained in terms of resources, so universal health coverage becomes a very critical component. And JPIGO has really invested in that, working very closely with the government to make sure that health becomes universal. And then in terms of leadership and governance, we really work very hard to make sure that we have policies that allow health to be a human right, so that products are available across all health systems. For example, if a product is only available in sub-county hospitals and above, what happens to women who give birth in lower level facilities? So those are some of the key highlights of some of the work that we've done to make sure that health is a human right. It's a journey. It's not a one day, one project, here 5-year intervention. It's an ongoing advocacy journey, and we continue in this work.
Wonderful. Thank you so much, Mike. So, if anyone on this call wants to learn more about the 6 health system building blocks, please get in touch with Mike. Now, moving on to our last question, I'd like to circle back to each of you, and I really do wish we had more time. Circling back to each of you to hear about how we prepare to uphold and secure rights for the years to come. So, what does this look like in the future? Where do you think the rightsation and work needs to go to in the years ahead? And I'd like to start with you, Mike.
Yeah, so I think it's all about collaboration. I know there's no one organization or individual can have health as a human right. We really need to collaborate and have a common voice. In smart advocacy, we need to agree on our ask to the government and to the key development partners and speak in one language, so that we get our ask known and then have the decision makers work on these barriers to be able to get solutions that will save our mothers and our newborns, and also bring high impact interventions to every health facility.
Wonderful. Thank you, Mike. Megan, what do you think this looks like 5, 10, 20 years from now?
Yeah. For me, there's so many areas this could go, but what's on my mind these days is really about how we defend accurate information about sexual and reproductive health in an increasingly virtual world. And I think a lot about how these very powerful forces, commercial, political, ideologically driven, are driving a shift in what information we are exposed to. And they can deliberately narrow, for example, through algorithms, what people perceive as acceptable choices for their reproductive lives. They can sow doubt and fear around services that are safe and essential, right? This is that growing misinformation epidemic. So just to say, I think in a world where most people, especially adolescents, the rising generations, are encountering information online long before they ever meet a healthcare provider, misinformation is the rights issue, right? If you can't access accurate information, you cannot meaningfully exercise autonomy over your choices. You cannot give informed consent because you haven't been fully informed. You cannot really even choose a method, the timing, or the care pathway that's best for you because what you've been exposed to is so narrowed, right? So going forward, I think our collective responsibility will be to make sure that digital spaces don't become barriers to rights, but enablers to them, which is also very, very possible. So that's where my mind's at these days. Yeah.
Oh, great, Megan. Thank you so much for sharing. And finally, Carol, tell us what you think this looks like in the future.
For me, there's lots of knowledge out there around the inequalities that exist, but recognizing that the populations that we serve are dynamic and the needs will keep shifting. So even as we are coming up with solutions, we need also to address the systemic barriers that really continue to widen the inequalities. So there is need for us to enhance the information and the power of the rights holders for them to hold these systems accountable. So it's not a top-down conversation. We need to empower the communities to champion for their own rights and for their voices to be heard in spaces where they have been neglected in the past. Thank you, Agnes and team.
Oh, thank you, Carol. Right holders. I love that. Now, Megan, as we wrap up, maybe you can check to see whether we have any comments in the chat. Could you kindly read out one or two? And as we do that, just to highlight that, thank you, Megan. If anyone would like any information on JPIGO, we have a website, so jpigo.org, and we're also on LinkedIn, and we would love to hear back from you. So, Megan,
Sure.
anything in the chat?
Yeah, I'm hearing one of our followers, Daniel, talked about how health is really a right and not a privilege, and really thinking about how we totally encompass and see that and ground ourselves in that idea. We also got a bunch more comments from folks about yeah, people want context for some of us. They want to ask more questions. People are saying, Ramya is saying that health means ensuring everyone can access the care that they need, whether that is in person or digital. And I think that's such a great point. Maria is saying that it's about every person without discrimination having access to quality. So many folks, there's a ton of comments here in the chat about what health as a human right means to them, but I know we're at time, so I'm going to keep scrolling through these and invite folks to continue adding, because the comment box will remain accessible and open.
Oh, wonderful. Maybe this means we should have another session soon. Thank you so much to everybody who joined the session. Thank you, Carol. Thank you, Michael. And thank you, Megan, for agreeing to participate in this session. We're extremely excited and thankful to everybody who joined. And as we wrap up, one thing is clear. Health is a human right. So from addressing gender barriers to ensuring reproductive health choices and delivering respectful maternity care. Now, Jhpigo's work reminds us that equity in health is essential for dignity and justice. And so thank you to our panelists and to everyone who joined us today. Let's continue to advocate for a world where every person can access the care they truly deserve. Thank you so much and have a wonderful day, everyone.